Hello, I'm Marianne Ryan, Ombudsman and Public Interest Commissioner for the beautiful province of Alberta, Canada. In joining you virtually, I would like to respectfully acknowledge that the members of our office speaking today are situated on Treaty 6 territory, the traditional lands of First Nations and Métis people in Canada. Like many of you, we at the Ombudsman's Office work to ensure our citizens are treated fairly. As North America's longest-serving parliamentary ombudsman office, we take seriously our role in safeguarding people's rights, regardless of social or economic standing. Vulnerable populations, including people with mental health conditions, suffer a range of disadvantages. Where jurisdiction allows, ombuds offer an essential service in ensuring people are protected from maladministration. The theme of my office's paper that you will hear about today, Giving Voice to Mental Health Patients, is well suited for the theme of this year's International Ombudsman Institute World Conference, Giving Voice to the Voiceless. The paper was published in February 2021 as a best practice paper on the IOI website. In its pages, we emphasize that people with mental health issues do not always have the ability or the resources to advocate for themselves or insist on their legal rights. Coincidentally, in 2019, two Western Canadian provinces independently initiated investigations into aspects of the admission and review processes where patients are involuntarily detained in psychiatric facilities. The findings of the two investigations are not only relevant in the Canadian context, but as the paper points out, academic studies suggest that the unfairness similar to what is found in Canada exists in other jurisdictions. The conclusion is confirmed by the fact that 9 countries have posted thoughtful and constructive feedback to the articles. Their contributions can be found at the end of the article on the IOI website. I will now turn over the discussion to Daniel Johns, Manager of Research and Institutional Knowledge, who was the key author.
The paper published on the IOI website serves two purposes. Firstly, as it relates to the theme of this World Conference, Giving Voice to the Voiceless, mental health is a global issue affecting patients of all walks of life. Bringing light to their experience and bringing them in discussions furthers the goal identified by the Special Rapporteur in the 2017 United Nations report that calls for open dialogue to support stakeholders in the implementation of mental health policies. Secondly, the paper presents ideas on how ombudsman institutions can protect disadvantaged groups. The idea for the paper was suggested by Mary Marshall, a former solicitor to the Alberta Ombudsman. Mary carries an ongoing interest in mental health into her private practice with Meadows Law in Edmonton, Alberta. Until late this last year, she was a part-time vice chair of the mental health review panels, which were the subject of the Alberta Ombudsman's own motion investigation discussed in this presentation.
The focus of this year's IOI conference on vulnerable populations and giving voice to the voiceless is a very important one. Patients who are in psychiatric facilities on an involuntary basis are very vulnerable from many different perspectives. They have had their liberty restricted in a non-criminal context. Treatment decisions may be made for them. They live in congregate settings and are subject to concerns around the spread of COVID. There is still stigma associated with mental disorders, and many patients are quite isolated. They may have lost touch with family members and other supports. The legislation in most jurisdictions carefully sets out checks and balances to make sure that the patient's legal rights are protected. The role of the Ombudsman, in my opinion, is of critical importance. The Ombudsman jurisdiction should provide a meaningful opportunity to receive and review complaints about compliance with those legal requirements. There are a few different ways that this may occur. First, does the board of the facility that detains patients have the appropriate mechanisms in place to make sure that the legal requirements have been met? Second, are there patient advocates that provide rights advice and assist patients with their concerns and complaints? Are those advocates performing their legislated role? Third, review panels hear applications from patients to challenge decisions that have been made around detention and treatment issues. Are those review panels acting in a fair manner? My experience is that the Ombudsman can provide patients, families, and others with the reassurance that there is appropriate oversight for these vulnerable and often stigmatized populations.
Behind me is Alberta Hospital Edmonton, one of 2 dedicated psychiatric hospitals in Alberta. As well, mental health patients are treated in general purpose hospitals. When attempting to protect vulnerable groups, an ombudsman should take into account the unique challenges experienced by these people, which may restrict their ability to complain to the ombudsman. Mental health patients come from across the social economic spectrum, but majority do not have the resources, inclination, or the ability to complain about their treatment, particularly at a stressful time when they are being confined involuntarily to a hospital. Nor are they likely to access other potential remedies, such as taking their issues to the courts. When complaints from a particular demographic or group don't arrive as often as the need suggests they should, an ombudsman can take proactive steps. Here in Alberta, we went many years without a complaint coming to us about the mental health review panels. Finally, we received a number of complaints starting in 2013. Based on our findings, we recommended change. Our recommendations were accepted, but never fully implemented. The slowness of reform motivated the Ombudsman to apply the strongest tool available to the office, a public investigation on the Ombudsman's initiative. The findings would be presented to the highest health authorities and the results published. Following the 2019 release of the Ombudsman report, all the recommendations were accepted. Change has already happened and continues under our watchful eyes. An ombudsman may be the best agent to give voice to the voiceless because an ombudsman can take a proactive approach. Investigations are free. The power of the ombudsman, such as the ability to compel information, allows for a thorough investigation. Investigations can be conducted in a timely manner by an agency expert in administrative and fairness issues. And the ability to publish results means recommendations are likely to be accepted and acted on. Coincidentally, our neighboring province, British Columbia, also released a related investigation report in 2019. The investigation addressed the protection of patients' rights by examining the completion of necessary paperwork at the time a patient is admitted. If properly filled out, completion of the forms goes a long way towards protecting the patient's legal rights. The forms give patients information such as the reasons for their admission, their right to a second opinion, their right to consent or not consent to certain treatment, and their right to a review hearing. Complete findings are published in British Columbia's paper, but in summary, all forms are present on the patient's files only 28% of the time. Presence of the forms is only part of the equation. The mere existence of the forms fails to reflect the fact that few of the forms were properly completed or not completed within required time limits. J. Chalk, the ombudsperson, concluded, "The poor compliance rates appear to reflect a prevailing view that completing the forms is secondary to providing psychiatric treatment. To the contrary, ensuring that involuntary admissions are legally sound helps to ensure that those who desperately need treatment receive it in a timely way." The Alberta investigations looked at the decisions of mental health review panels which, after admission, hold hearings within a week. The panels also look at renewal certificates and can review some treatment decisions. In her own motion investigation, the Ombudsman found patients were not fully informed of the reasons why they were detained, patients were not given proper notice of hearings, or their option to waive the time limits for a hearing. Many hearings are not held within the required time limits. Patients were inconsistently told of their right to access a lawyer. Patients were not told they could review their medical files. Patients have the right to appeal to a court within 14 days, but in over half of the cases, the reasons for the decision were not delivered in a timely manner, or the Ombudsman could not determine when the reasons were issued. Unless reasons are delivered in a timely manner, it is difficult for a patient to appeal to a court. A complete survey of admission and review processes around the world is outside the scope of this talk in the article presented on the IOI website, but the academic literature shows similar processes with similar shortcomings exist in many other countries. feedback from several countries to this paper confirmed this is true. The second goal of the paper was to present ideas on how ombudsman institutions can protect vulnerable groups. The IOI is collecting best practice papers, and in our submission we discussed 10 points on how to design an investigation to give voice to the voiceless. A further explanation of each can be found in the paper itself. For this presentation, we will only address a few of them. Individual complaints are important, but insufficient. Be proactive. For most ombudsmen, complaints from the public continue to be the primary source for new investigations, but vulnerable groups often complain less. The simplest reasons are they don't know we can help them, or perhaps their troubles are overwhelming and consume all of their attention. In the absence of active complaints, the Ombudsman must be proactive within communities to listen for faint voices from affected groups. How to do this? Within the Ombudsman's own office, intake workers listen constantly. Many calls don't end up as full complaints, but the calls may identify themes. Contacting advocacy groups may also help. A good source of feedback is government workers themselves. They may be frustrated with their ability to provide the service they believe are necessary and contribute useful information. Aim for achievable issues. The British Columbia Ombudsperson's investigation is a good example of the adage, small enough to win, big enough to matter. Rather than take on a general investigation about involuntary admissions, British Columbia chose the right size investigation. Looking on forms was big enough to drive home the lesson that legal rights matter. It also allowed measurable findings. Either the forms were on file and filled out correctly, or they weren't. Measurable findings are difficult for respondent public bodies to ignore. An investigation with a broad, less specific scope might have lacked focus, and the results less likely to be accepted. Follow up on recommendations. Public bodies generally agree with published Ombudsman reports, but are they committed to change? It is a good idea to let the public body know the Ombudsman will check at a later date to see what change has occurred. Even well-meaning public agencies can let matters slide. Knowing the Ombudsman will issue a report card at a later date keeps matters moving. Explain the findings and consider the context. It is no secret that large public investigations generate welcome news coverage which aids the Ombudsman cause. As much as an Ombudsman should welcome the spotlight, the ultimate goal of an Ombudsman investigation is to help citizens and reform government. Therefore, effort should be invested in ensuring all of the findings are thoroughly understood by all parties. Any feedback received allows for fine-tuned recommendations that are more likely to achieve buy-in and a commitment to improve. Recommendations should be presented in a way that motivates administrators to change. Experience shows that consulting with them before releasing the outcome of an investigation often results in the authority making immediate changes, so that when the report is released, they can tell the media they have already taken steps to correct the problem. Listen to affected groups. New Zealand suggested this point be added to the lesson summary. It is congruent with the theme of the conference, giving voice to the voiceless.
The goal of the Alberta Own Motion investigation was to ensure that provincial policy and law protecting a patient's legal rights were recognized and respected. Protecting these rights ensure a vulnerable person has a voice. In addition, the government accepted our recommendations, as well as a decision by a court of law which reached similar conclusions. As a result, the government amended the Mental Health Act, a process that involved extensive public participation. Other changes include expanding the mandate of the mental health patient advocate. Going forward, the advocate will inform patients of their rights, another step in ensuring individuals have a voice. This brings our presentation to a close. Thank you for listening.